Good morning to everybody in the United States attending this webinar, and good afternoon and good evening to everybody else. We are now starting a webinar to discuss the recent advances in the treatment of autism, cerebral palsy, and certain other incurable neurological disorders. So, I'm Dr. Alok Sharma from India. I'm a neurosurgeon. I'm director of the NeuroGen Brain and Spine Institute and the professor and head of Department of Neurosurgery at LTMG Hospital Medical College, both in Mumbai. So, before we begin, I'd like to make a disclaimer that this presentation is for information purposes only. It is not a substitute for a medical consultation, for which you should consult your local doctors. And we gratefully acknowledge the parents and caregivers in the United States who have invited us to make this presentation and who have made all the back-end efforts to have all of you registered. So I'd like to thank the local organizers. So why are we here? We are here because all of us who have registered will be having special needs children, children with autism, cerebral palsy, other neurodevelopmental disorders. There will be others with other neurological problems. And we are here because the people we love and care for have a problem to which the conventional medicine doesn't have the appropriate solutions. So what has happened is that, you're told when your child has autism or cerebral palsy, you're told there is no cure. You're told that there is no surgical intervention. You're told that the only thing that you can do is rehab, and that there are no medicines. And I am here to tell you that this old paradigm is no more true. That we have a combination of treatments available today that can make a significant difference in the quality of lives of our children. So what is new? What is new is a combination of cell therapy using stem cells, a combination of a comprehensive rehabilitation plan, and certain therapies that we refer to as integrative therapies that use modalities like hyperbaric oxygen, ozone, etc. And what we are finding is that when we combine these three, we are able to do something that was earlier not possible, and which is to actually reverse the symptoms and signs of neurodevelopmental disorders such as autism and cerebral palsy. So we are going to show you how these combination therapies can shift patients and families from a state of hopelessness to one of hope. Now, I'm showing you this for a reason. So on the left-hand side, you see an X-ray of a broken bone. This is the leg bone, and you can see that both the bones are broken, fractured. And I ask you, if we or our children or anybody we knew had a fracture of the leg like this, would we do rehabilitation only on a fractured bone? Would we start doing physiotherapy on this bone? We would not, right? What we would do is we would go to an orthopedic surgeon who would put plates and screws and fix the fracture. And once the fracture was fixed, then we would start rehabilitation. But when our child has a neurological problem, we are doing exactly the opposite. So here is a PET scan where the blue area is the area of damage or area that's not functioning appropriately. This blue that you see on the left-hand side. And this is a scan of a child with autism. And we are giving rehabilitation on a brain that's not completely functional, a brain that is weaker than normal brains, a brain that is part of it is not functioning and is partially damaged. Now what if instead of this we gave rehabilitation on this? You can see this green part. This is brain that has recovered or regenerated. Would we or would we not get better results if we did rehabilitation on a brain that is recovered? The answer is very logical. Of course, yes. When we have a brain that's recovered, we will get better results. And today I'm here in this webinar to show you that we can repair this damaged brain. And how we can repair it, we're going to have a look at shortly. So the old thinking was that once the central nervous system is damaged, it is incapable of regeneration. This has been the thinking for 150 years. It's ingrained in the medical profession. It's ingrained in us as students that when the brain is damaged, you can't do anything. But that's old thinking. The newer thinking is that some amount of regeneration is possible through a process of cellular replacement and repair. Please note, cellular replacement and repair. When we use cells to replace damage, we can get regeneration. So this is the new thinking. So we are going to look, I told you there were three combinations. The first was stem cell therapy, then was rehabilitation, and then was integrative therapy. We are going to look at all these three together. So I call stem cell therapy an idea whose time has come. And we've had, in the field of medicine, we've had breakthroughs. Like there was a time when there were no x-rays and you could not see what was happening. If you had a fracture, you could not see it. You could not see what's happening in the body. And then x-rays came. And there was a shift. It was an idea whose time has come. Suddenly we could see what's happening inside the body. There was a time when simple infections killed people. And then Alexander Fleming discovered penicillin. And once antibiotics were discovered, we could combat the most serious infections. So there have been situations in medicine where an idea has come whose time is ready. And at that time, everything shifts in medicine. And I believe that cell therapy is one such idea. So the word stem comes from the stem of a plant. And just like the stem of a plant gives rise to leaves and later fruits and flowers, there are some cells in the body which can give rise to any cell of the body. So there are some cells which can actually give rise to a brain or a muscle or a heart or anything else. So the word stem comes from the stem of a plant or a tree. Now there are different types of stem cells. You can get cells from our own body, which we can take from one part of our body and put it back into another part of our body, and these are called autologous. There are also cells which you can take from outside, from somewhere else, and that is called allogenic, where there is a donor and a recipient. So stem cells basically have the ability to replace and regenerate. That's what their main property is. And I'd like to share a small video of Stephen Hawking. We all know Stephen Hawking, one of the greatest scientists there ever was, along with Einstein and Isaac Newton. And this is what he had to say about stem cells. So what Stephen Hawking said was, we are on the brink of a new era in the field of medicine. A time when we will be able to heal our body of all diseases from cells within us. And these are called stem cells. Stephen Hawking had a disease called motor neuron disease, for which there was no solution, where stem cells are the only thing that could help. And so he was a big believer in stem cells. In fact, he did a 10-part TV serial in the American channel on stem cells. So how do stem cells work? So the first property of stem cells is that they multiply. So if you have a single stem cell, you can make thousands or even millions of stem cells from a single stem cell. So they multiply. The second is this unique ability of their being able to convert into any cell type. So if you have a single stem cell, you can make that stem cell into a nerve cell or into a heart cell or into a muscle cell or into a blood cell. So the same cell can convert into any cell of the body depending on where we put it. So that's a very unique property, the ability to convert into any cell type that we want. And this is a work from our own research. What you see here around is what a stem cell looks like. And when we grew it in the laboratory, we could convert it into these. These are nerve cells. And not only could we convert the stem cells into nerve cells, but these nerve cells are actually communicating with each other. So we showed before we started treating patients that stem cells can convert into nerve or brain cells, and that these brain cells make connections with each other. The other effect of stem cells is referred to as a paracrine effect or the release of certain positive chemicals. These positive chemicals are called growth factors. And when we put in stem cells, it flushes the whole brain and the nervous system with these positive growth factors. Stem cells also improve the blood supply. So wherever they go, they attract new and fresh blood towards it. So this is just to show you, I mean, this is, just something I made up. In 1990, I qualified to be a surgeon. That's, long time ago. And at that time, if I had to type something, I used a computer. If I had to do calculation, I used a calculator. If I had to take still pictures, I used a still camera. If I had to take video pictures, I used a video camera. If I needed to see direction, I used a compass. To listen to music, I used a Walkman. And to watch television, you saw TV. If I wanted to find a place, I had these big maps. If I wanted to put an alarm, I used an alarm clock. If I wanted to read, I studied from books. And if I had to telephone, I used a landline. And if I needed light, I used a torch. This was 1990. That's not so long ago. But today, all of this can be done by the mobile phone that you hold in your hand. That's technology. That 30 years ago, what we needed so many things for is now in the palm of your hand. And just like this, just like all these things can be done by what is in the palm of your hand, various treatments from modulating the immune system to improving the blood supply to preventing cell death to preventing inflammation, having an antioxidation effect to cell migration, all of these things for which earlier we required different medicines and different surgical procedures, and many of which were just not possible. All of these today can be done with cell therapy. Now, there are different types of stem cells, and it's important to understand the different types. You can get stem cells from the embryo. This is from the unborn fetus in the mother's womb, either through abortion or through the spare embryos of test tube babies. And when we were born, all of us, we were born when our father's sperm and mother's egg came together and formed a fertilized egg. On the 5th day of life, this single egg had become a grape-like bundle called blastocyst, which is a bundle of stem cells. And from here, the whole human body was formed, which means all of us, on the 5th day of life, we were all a bundle of stem cells, all of us. And from that bundle of stem cells, the entire body was formed, which means that these cells have the capacity to become any cell type in the body. Now, if these are taken out at this stage, you can make them into any organ that you want. So these cells are called embryonic stem cells. However, these stem cells have a lot of ethical issues. There are religious groups that don't permit their use. They're also medically dangerous. So we do not use embryonic stem cells. I wish to state very categorically, everything I'm going to present to you now is from cells other than embryonic stem cells. We do not use embryonic stem cells. You can also get stem cells from the umbilical cord. That is the cord that connects the mother and baby at birth. And if you've saved your child's umbilical cord, stem cells from there could be extracted. But we are not using this either. The third form of stem cells are adult stem cells. Adult stem cells, they're called adult, but they are there in our children also. So all of us, in different parts of our body, inside our bone, in our fat, within our teeth, at different places, we have stem cells. Now, the bone is the easiest to get because it's very easy to enter a bone. You can enter with a needle and you can take out the liquid inside the bone, which is called bone marrow, which has got millions of stem cells. So whatever work we do with adult stem cells only. That means stem cells taken from the child's body or from our body and put back into us. Nothing from the outside. The last type of stem cell is induced pluripotent stem cell, which is a combination of adult and embryonic, where the outside is adult and the inside is embryonic. But this is in a very early research stage, so this is not being used in people, humans so far. Now, why have I taken trouble to explain this to you? Because, when you talk to your doctors and when you Google, etc., you hear negative things about stem cells, that they are dangerous, there are ethical issues, they become tumors, so on and so forth. Whatever you hear is about embryonic stem cells taken from a mother's womb through an abortion or the spare test tube babies. It is not at all true for adult stem cells, which are taken from the body and put back in the body. So cells taken from somebody else's, from another woman's womb, and stem cell derived from that cannot be compared to stem cells taken from our own body and put back into us. And comparing the two would be like comparing the risk of alcohol with homemade orange juice, because both are beverages. Can we say that alcohol is alcohol is a beverage, orange juice is a beverage, so both are similarly risky? You cannot compare the two. Likewise, you cannot compare embryonic stem cells with adult stem cells, which is like homemade orange juice. So that's the difference. We therefore work with adult stem cells because they are very safe. They have been used for the last 60 years to treat various other disorders. They never form tumors. They don't get rejected because they are from your own body. It's very easy to get them from a single needle prick, and there are no ethical issues concerning the use of adult stem cells. Now, that is where we get it from. But how do we put it back in the body? So there are different ways of putting it back in the body. We can, through a very thin needle, inject it into the back, into the fluid in the back, which takes it to the brain. This is called intrathecal, and this is our preferred method. Through a simple needle, we inject it into the fluid in the back so it goes directly to the brain. We could also inject it intravenously, like a regular injection. We could inject it into the muscles. We could inject it into the arteries. We could put it through the nose. We could, inject it directly into the brain. So there are different ways of injecting stem cells, but we prefer the intrathecal method. And we prefer intrathecal because it's minimally invasive. It's just a simple needle prick, and you go enter the spinal fluid. It's got no major side effects. It's very safe, and it goes directly to the brain. When we inject it, it goes directly to the brain, and these stem cells can't go anywhere else because they will circulate within the brain. So stem cell therapy, basically, if I had to summarize in a single sentence, we are using healthy cells to replace damaged cells. For example, this is the damage in a brain of a child with autism. If we put stem cells into it, the damage would go away. So what is the scientific base for stem cell therapy? Now, you're all aware that the highest recognition in medicine is called the Nobel Prize. And 3 times in a 15-year period, in 1990, in 2007, and 2012, the Nobel Prize in medicine went to stem cell research. It's never happened before that one topic, one field has got the stem cell, has got the Nobel Prize 3 times in such a short period. So that's evidence of the scientific base for stem cell therapy. And what is the scientific base of the work that we do? So all our work is published in peer-reviewed international and national journals. We have a total of 101 scientific papers. What is the importance of this? What is the meaning of this? So you will see it says peer-reviewed journals. So when we publish something in a scientific journal, the journal's editor, editorial board, and at least 3 independent reviewers, they review the data. They check its authenticity, its scientific value, its ethical base. Only then they publish. So when your work is peer-reviewed, it means somebody outside of you has studied your data and validated it, that it is worth scientific publication. So it's not just we are saying it, and we don't have, it's the journals who have validated this data. And we don't have 1 or 2, we have over 100 papers. As you can see, 16 in autism, 15 in cerebral palsy, 18 in muscular dystrophy. This is the largest number of scientific papers of stem cells and neurological disorders anywhere in the world. So we have the largest number of stem cell papers in neurology. Apart from scientific papers, now there are medical textbooks, and they have started introducing chapters of stem cell therapy. So this book by the SMG, by the SM group on recent advances in autism, they have a chapter on stem cell therapy, and they asked us to write this chapter. So we have written this chapter for the medical textbook. There's another book on cerebral palsy, challenges for the future. It's a European book from Intech. They introduced a chapter, Stem Cell Therapy in Cerebral Palsy. Again, they asked us to write the paper, so we have written this paper. In this book on physical disabilities, therapeutic implications, there's a chapter, Stem Cell Therapy in Pediatric Neurological Disorders. Again, we have written this paper. In this book by Avid Science on muscular dystrophy, there's a chapter, Stem Cell Therapy in Muscular Dystrophy. And again, they invited us to write the chapter. So apart from scientific journals, in medical textbooks, stem cell therapy is being introduced as separate chapters, and most often when people edit these books, they invite us to write it because we have the largest number of cases treated and the largest number of scientific papers. Within India, the government of India at the highest level is very supportive of stem cells. Our Honorable Prime Minister Sri Narendra Modi ji, when he visited Japan, he actually took time out to meet Professor Yamanaka at the Kyoto University. Professor Yamanaka was the one who won the Nobel Prize for the stem cell work. In India also, whenever he gets an opportunity, he makes it a point to visit stem cell facilities. I'm very fortunate that for a book that I have written, Honorable Sri Narendra Modi ji has written an introduction. This is me presenting that book to him. It is not often that somebody of his stature will write an introduction for a medical book. And this is the book you can see. It's translated into one of our native languages, and Sri Narendra Modi has written the introduction for my book. He also, in Parliament some time ago, made a very impassioned speech about the importance of stem cell therapy, and I'd like to share that video.
मैं जापान गया, तो जापान मेरे कार्यक्रम में मैंने एक कार्यक्रम क्या जोड़ा, मैं वहां एक नोबेल लॉरिएट साइंटिस्ट याकामाहा को मिलने गया। मैं इसलिए किया गया कि उन्होंने स्टेम सेल के अंदर जो रिसर्च की है, मैंने जितना पढ़ा था तो मेरे मन में आया था शायद इनकी एक खोज हमारे काम आ सकती है क्या। हम गए तो वहां गए, उनसे चर्चा की, और बेंगलोर के हमारे साइंस इंस्टीट्यूट के साथ आज उस दिशा में हमारा काम हो रहा है कि स्टेम सेल्स के द्वारा हमारे युवा साइंटिस्ट कुछ खोज करें।
So that was the Prime Minister of India speaking in the Indian Parliament about stem cells. And that it's not very often that presidents and prime ministers talk about any medical topic. And here is our Prime Minister talking about stem cells. So how is this treatment done? The beauty of this treatment is the sheer simplicity. There is no surgery involved. There is no cutting, there is no stitching, there is no suturing. What we do is a 3-step procedure. We put a needle into the pelvic bone. This is the bone above the hip bone. And this is a picture. I will shortly show you a video as well. We put in a needle. And then when we aspirate the needle, the liquid inside the bone comes out called bone marrow. This takes about 15 minutes. We give local anesthesia so the child feels no pain. And there is sedation so the child is sleeping comfortably. We then take the bone marrow which we have aspirated, we take it to a laboratory, and next over a couple of hours, we actually filter it, we separate out the stem cells from the bone marrow, and it's a separation process. I mean, there are no chemicals, agents added, we don't grow culture, we just separate. And when the stem cells are separated with a very thin needle, we inject it into the lower spine so that it enters the fluid and the fluid takes it to the brain. So there is only, the whole procedure has 2 needle pricks. With one needle prick, we aspirate, and with another needle prick, we inject back. So just 2 needle pricks. And we are putting the child's own cells. We are taking good cells from the bone, filtering them, and putting it back. So that's the beauty of the treatment. Just 2 needle pricks, no surgery, no cutting or stitching. So let's see a small video of how this is done. You can see that this is the aspiration. The child is sleeping and you can see the bone marrow is coming out. We take it to a laboratory. It is run through various machines and then a cell counter that counts the cells. And then through a very thin needle, we inject it into the lower spine. That's what the stem cells are. So we'll just see that video again. So there you can see, this is the bone marrow as it comes out. You can see the child is sleeping comfortably. We put it to a machine called a centrifuge. Once the cells are ready, they get counted, they get checked for quality, and then with a very thin needle, we are injecting it into the lower back. So that's all there is. Again, just to show the bone marrow aspiration, the stem cell separation, and the injection. So now let us look at a little bit about, we are going to look at about 6 different disorders. I'm going to talk in particular detail about autism because I was told by the organizers of the webinar that the majority of parents listening in will be parents of autism. So we're going to spend a little more time on autism and then a little less time on the other things also. So autism is a neurodevelopmental disorder. It was first described in 1943. It appears in the first 3 years of life, and we broadly classify it as mild, moderate, or severe. It's now referred to as a spectrum disorder. We don't use the word autism, we say you're on the spectrum. And boys seem to have it 4 times more than girls. Now, what is strange is the phenomenal increase. When we were medical students in the 80s, there hardly used to be any autism. We never heard of autism. Our textbooks hardly had any mention of it. And you go back to the 2000s and you can see the incidence was 1 in 66 in 2004, which has reached 1 in 59 in 2018, and now it's even greater. With each passing year, the incidence of autism is increasing, and there's something really wrong. Never before in the history of medicine has any disease in children increased so rapidly as autism. And it's not getting the attention and importance it deserves, which means that there are 70 million people with autism, on the spectrum today. 70 million people, that's 1% of the world's population. 1% of the world's population is on the spectrum. That's huge numbers. And this definitely needs more attention from the government, from policymakers, from administrators, because I don't think enough is being done for autism. The main problem with autism is a complex of 3 things. 1, there is a problem with communication. 2, there is poor social interaction, and there's repetitive behavior. So this combination of symptoms is what causes all the issues in autism. So what is new about autism is first our understanding. So today we have specialized brain scans. They're telling us exactly what is happening in the brains of these children. And this has not been studied in so much detail, and we've done a lot of research on it. In literally thousands of children, we've actually studied their brains, and we've identified those parts of the brain which are not working appropriately that cause the symptoms. So what is new is our understanding. And second is, of course, the availability of stem cells. So a fundamental question all parents ask myself, why did my child develop autism? So very briefly, we will look into that. There are 4 different set of factors: problems during the birth process, just before or immediately after, problems in the intestine, toxic chemicals, and the use of exposure to radiation from mobile phones. So the mother's health, both physical and emotional, is very important if you have to prevent autism. So we find that infections in mothers, diabetes in mothers, these are important causes. If the mother has polycystic ovarian disease, mothers who smoke, and also mothers who have emotional issues, who are in depression or are using antidepressant drugs. So mothers with all of these things are more likely to have a child with autism. So the mother's physical health and emotional health. When we talk of health, we normally think only of physical. A happy mother, a mother who has emotionally and psychologically satisfying pregnancy is less likely to have autism than a mother who's been through a stressful pregnancy. Older age of the father is an important factor, because now we are finding that we are having children at an older age as compared to many years ago. A father at 45 years is at a 3.5 times greater risk of having a child with autism than a father at 24. So obviously it's better to have children earlier. Problems in the gut. So we are finding that 9 out of 10 children with autism have a problem in the gut. There were imbalance between the good and bad bacteria in the gut, and this has to do with with the fact that it was earlier recommended that we should exclusively breastfeed for the first 6 months, but that's not happening. We are introducing our newborns to outside foods much earlier than what was prescribed, and the gut is not able to handle, a newborn child's gut is not able to handle anything except mother's milk. Also, at a very early age, our children start eating junk food and fast food, and all that affects their gut. So the gut has a correlation to autism. Now, this is something most people are not aware of, that radiation from mobile phones the radiation travels a very short distance, but a mother who speaks a lot, uses the mobile a lot when she's pregnant, the radiation can directly affect the developing child's brain. And we also know what it does. The radiation from the mobile phone affects what is called the blood-brain barrier. So the blood-brain barrier is a security guard which God or nature has given to our brain. So our brain has a barrier that does not let anything from the blood enter. It sort of checks, like how we have security guards. It checks you before. It checks what's in the blood. Now, are you good enough to go inside? And radiation from mobile phones damages that. So now the security guards between the blood and the brain are gone. So more negative things can enter. So it's very important that this message goes out to our sisters and daughters who are going to have children, that during pregnancy they should keep the mobile phone at a little distance. You can use the mobile phone, use Bluetooth or hands-free, but you should not keep the phone close to you. Toxic materials. So we are finding that a lot of our children have high levels of lead. Sometimes their mothers have high levels of lead. And we now know that this can cause damage to the brain. In fact, in a study done by an Australian university in India, they found that very high levels of lead in children with intellectual disability and children on the spectrum. And the sources of these, included things like eyeliners and noodles. One of the most popular brand of noodles in the country had high levels of lead. So we have to protect our children from this. Then mercury as well as aluminium. All these things can also potentially cause autism. Now, here, this is something very controversial. In 1998, Dr. Wakefield published a paper that showed that the preservatives used in the vaccines could be causing autism. And this raised a big sort of storm in the medical world. And because then later there were 25 other papers that showed that there was no relationship between the MMR vaccine and autism, and that paper which was published had to be withdrawn, because the danger of this was that if parents had stopped vaccinating their kids from all vaccines, and that is potentially dangerous because there are so many diseases, smallpox and polio, etc., which we have eradicated using vaccines. So it's more dangerous to not use a vaccine than to use a vaccine. And this is still a controversial area. We're still not sure as to whether vaccines do or do not cause, but our medical view is all children should be vaccinated. The harm from not vaccinating is much more than the harm from vaccinating. Now, this is the new development. So this is a scan called a PET-CT scan, and the blue area that you see here is area that is hypometabolic or area brain that is functioning less than normal and could be potentially partially damaged. And we have studied now we are reaching close to 3,000 patients of autism whose scans we have done, and every child with autism has this pattern of brain damage. This was not known before because you don't see this on the MRI. Your doctors would normally advise you on MRI. An MRI is a test of structure. It doesn't show you function. The structure of the brain of these kids is normal. The problem is in the functioning. And you can only see this on a PET scan, which is a positron emission tomography scan. So this work of ours is published. There's a prestigious journal, World Journal of Nuclear Medicine, where we have actually published what is the problem in the brains of our children with autism. And this has not been described before, but we have described it now. And what we found was in our research something rather interesting. So below is the age. This is 0 to 5, 5 to 10, 10 to 15. And these are SUVs of brain values, values of how much the brain is functioning. The higher the value, the better it is. So if you see a normal children, blues typical children, between the ages of 3 to 5 to 10 to their brain functioning keeps on increasing. These are normal children. In children with autism, their brain function keeps on decreasing over the years, right? And we didn't know this till we were in the middle of our research, and suddenly we saw that the brain functioning is actually getting less. Now, why is this important? This is important because what do we want for our children? We want our children's brains to develop normal, like this, all right? Which means if we treat the children here, we have to only bridge this gap. But if you treat them here, you have to bridge this gap. Now, it's obviously easier to bridge a smaller gap than it is to bridge a larger gap. So this is the importance of early intervention. You keep hearing early intervention for rehabilitation, early intervention for the various integrative, biomedical, all the other complementary therapies. And the same thing is true for stem cell therapy also. We need to start treatment earlier because the decline in the brain function is progressive. So the management in the last 10 years or so of autism has changed to a multidisciplinary management. There is no silver bullet. There is no one thing you give it and the autism goes. No, it is going to be a combination of treatments. And these are all the various rehabilitation therapies you're all familiar with. We'll just run through them very fast. Stem cell therapy is a part of this. It's very important to understand. Stem cell therapy does not work in isolation. It has to be combined with and complemented with a rehabilitation program and the other integrative therapies such as hyperbaric oxygen, etc. So that was the first part of my presentation. That was the part on stem cell therapy. Now we're going to look at rehabilitation. So in rehab, there are different, I'll run through this fast because all of you are familiar with this. We have ABA or applied behavioral analysis. The base of this is that every behavior has an antecedent effect and a consequence. And if you modulate the antecedent effect or the consequence, you could modulate behavior. This is done by psychologists and is a very powerful tool in the management of autism. Every child who requires it should undergo behavioral therapy. There is, of course, occupational therapy, which consists of different aspects from activities of daily living to social skill training, cognitive behavioral analysis, vocational rehab, etc. So occupational therapy is very holistic and it involves multiple different aspects. Then there is sensory integration, which is a part of occupational therapy. And this is in particular for the sensory issues that the children have. And this is what an SI room looks like. This is the sensory integration room at our hospital. Then, of course, there is speech therapy, which has a very important role to play because speech is a major issue with children with autism. There is physiotherapy. Now, earlier it was believed that physiotherapy has no role in autism because apparently they don't have a physical problem, but that's not true. Our research, and when we study these children in detail, shows us that they have motor coordination issues and they have certain clumsiness in their limb movements and they have tone problems and gait problems. They have postural stability issues and joints, etc. So, physiotherapy has an important role to play in autism as well. Aquatic therapy we found is amazingly beneficial. So this, because it helps in so many issues, from their attention and concentration and improving the sleep patterns and reducing their hyperactivity. Aquatic therapy. Now, aquatic therapy is not swimming. Aquatic therapy is rehabilitation in water. And we are big believers, and we have aquatic therapy as part of our rehabilitation program. Then there are various art-based therapies, and music therapy and dance therapy, etc. Then there is, of course, the removal of heavy metals. So there's chelation, TRS detox, and very often parents have already undergone this. So if there are high levels of toxins, they should be eliminated. A lot of parents use supplements, so whether it's vitamin B6, vitamin C, omega-3, DMG, prebiotics like inulin, etc. So supplements do play an important role, and parents ask us, should we continue? And of course, yes, you should continue all the supplements. They have a role to play. Diet has an extremely important role to play, and the important thing is there are certain foods to eat and certain foods not to eat. So probiotics and prebiotics, ketogenic diet, gluten-free, casein-free diet, things like camel milk and curcumin, they all have very beneficial effects in children with autism. The foods to avoid are sugary stuff, things with additive pesticides, things that are genetically modified, etc. A ketogenic diet has a very important role to play because with its content being high in fat, just enough proteins, but low on carbohydrates. But we look at all this, and chances are that most of you have done most of the things that we listed. But are we doing enough? And the question is no, because despite everything we do, that damage in the brain, the blue stuff I showed you in the scan before, that does not go with just rehabilitation. Okay, so we have to fix the damage in the brain. And there is the role of stem cell therapy. So these are results from cell therapy. We have now treated almost close to 3,000 patients. This is data from 700 because you have to analyze the patients over a long period, over 2 years, before you can put their data together. And this shows that 89% of the patients showed improvement. 33% had a significant improvement. That means they became neurotypical. They had no more had the diagnosis of autism. Yes, you heard me right. 33% of our treated patients got rid of their autism diagnosis. 29% of the patients had a moderate improvement. What is moderate? Moderate is when they become independent. They don't need special care, but they still have some symptoms. That means when you evaluate them, they still have some symptoms of autism. Mild, that's 25%, had mild improvement. That means they were still dependent, and they, of course, still had autism. And 10% of our patients did not improve. Now, as parents will be wondering, but how do I know? Is my child going to be in that 33% or is my child going to be in that 10%? So I'll tell you what we were also very keen and we studied this. And what we found was something very interesting. We found that all our children in this 33 improvement, they were all below 11 years. In fact, they were all before puberty. We all know what puberty is. It's the time when a boy becomes a man. The boy gets a mustache and the sexual genital organs start, changing. In girls, menopause is girls. The menstruation starts. So that's puberty. If we do this treatment before puberty, there is the possibility of completely reversing the autism. Now, those who were up between 11 and 20, they came in the mild and moderate group. And this 10 to 11% who did not improve, they were all over 20 years old. So basically, this means that the earlier we treat the children, the better are going to be the results. Our data shows that. Okay, so and I'm emphasizing this because very often, your doctors, your therapists, yourself will tell you, well, let's wait till this treatment is more established. Let's wait. The longer you wait, the lesser are the chances of a child having a complete remission from the autism. So, like in any other disease, is there any disease, whether it's an infection or whether it's a cancer or whether it's regeneration, where we say wait, okay? When we detect it, we go and do everything possible to cure or eradicate the disease. The same should be true of autism as well. So this is just to show you the different types of symptoms, the percentages of improvements that are there. And now I am making a claim that stem cell therapy and a combination treatment works for autism. On what base can I say that? I mean, what makes me say that? I need two evidences. One, my data has to have statistical significance. And second, I must have objective proof. Not I'm saying or the parents are saying, objective proof. So let me show you all of that. So this is a score, the CGI score. This is the Indian score for autism. And we took all the patients we treated and took the average before. So this was the average of all the patients before, 4.5. And after the stem cell, the average was 3. And by a mathematical calculation, we show that it is significant. The same of the ISA score from 115 to 97. This is an average of all the patients. So only when this is significant can we say it works. And if you subdivide it, social relationship, emotional responsiveness, speech, behavior, sensory issues, all of them, the mean average before as compared to after was statistically significant. So now we can say that our data has statistical significance. But most important is this objective proof. Now I'm going to show you 2 or 3 scans, but I have almost 3,000 scans. Yes, you heard me right. Over 3,000 of these scans. Before and after that shows that the damage can be repaired. So let's look at the scans above. You see these 3 pictures above. This is a horizontal section. This is a frontal section. This is a lateral section. So you're seeing the same thing in 3 angles. And you can see the blue is the damage before. And the scans below are 6 months afterwards. And you can see that the damage is significantly reduced. Look at the damage here, and you can see significantly reduced. You can see here the damage above, and on the similar section, 6 months later, it's almost gone. You can see the extensive damage before, and 6 months later, you can see significantly reduced. So this is objective proof that the damage in the brain of children with autism can be reversed. I believe it is completely unfair and unjust that when there is damage in the brain of our children that can be changed through just 2 needle pricks using the child's own cells in a manner that's safe and simple, that we should not offer this opportunity to our patients, to our children. I think it makes no sense to not do that. And this is just a couple of other scans. You can see here the blue above, that is before the stem cells, and you can see a scan 6 months later and it's gone. Again, you can see before, and this child, apart from autism, had CVI, had a visual problem before, and you can see that's the occipital area, and that has almost completely cleared up. So this is to show you that the damage in the brains of children with autism can be reversed. But then we do these scans after 6 months, and some people ask, but how do you know that this doesn't come back? 2 years, 3 years, 4 years, does this blue come back? And so with a few parents who are willing, we did this year after year. So you can see this in 2012, you can see this damage. In 2013, you can see it's lesser. In 2014, it's still lesser. So we showed that the improvement is sustained and progressive, that over the years, that improvement continues. So it's not like it improves and then we do a scan and it comes back again. No, that does not happen. So the work we have done is published in a prestigious journal, Stem Cell International, and the world's first international PubMed index paper on stem cell therapy in autism has come from our country, from India. It's been written by us. This is the world's first paper. And the second paper came from China. The third paper came from Italy. The fourth and the fifth paper came from Duke University in America. So we are the first to publish this, and we are pioneers in this, even when compared to America, which started this work much, much later. Apart from the world's first paper, we also have a total of 16 other papers total. Now, a question very often parents ask is, can you combine cell therapy with other treatments? So that's the beauty of stem cell therapy. You don't have to stop anything that you're doing. Whatever you're doing, whether it's biomedical or chelation or HBOT or supplements, everything can continue like it was before, after stem cells. So we are not going to change anything that you're doing because our treatment doesn't clash or come in conflict with any other treatment. So, we have 5 videos, a child from each of the continents, a child from America, another one from Europe. We have a small video on triplets from Africa, a child from Asia, from India, and one from Australia. I don't think we may have time to see all of these, so I'm going to just show you maybe 1 or 2 of them. So this is a video of a child from the United States, and his father is a cardiologist in America, and mother is a nurse. They had this lovely child, Ganesh, and let's see what improvements he had.
We went to.
So I'll show you another interesting video till we can get that one back. This is a, so all of you parents there, you know how difficult and challenging it is to manage. You of course know manage one child with autism. I mean, I want to show you a story of a mother who had triplets, all three of whom had autism, and they took stem cells. So let's see the story of a mother who had to manage three kids with autism.
We went to different doctors, we went to different hospitals, and when I brought it up, they were like, oh, no, don't worry, it's because they are boys, they are triplets, they were premature. I would be walking out and I'm like, bye. No child is crying, no child is waving back bye. And by then, for sure, I knew that they should be doing that. The children had this behavior of disappearing. In fact, Eric disappeared 3 times in the middle of the night. The biting, the spitting, the scratching. How are we going to stop this behavior? We went to see the neurologist, and in 5 minutes, he said, these children are autistic.
As parents, it was very traumatizing. First of all, we didn't understand what autistic means.
So I decided to really get to read a lot about autism. I remember the first time I read about stem cell. I was like, wow, this is really good.
We had a lot of questions which we asked, and we got very clear answers from Dr. Sharma.
The day of the stem cell itself came. Actually, I was a bit anxious, of course, but really I didn't have fear. A bit of apprehension, anxiety, of course, as a mother, but I knew they're in good hands.
We put a needle in this pelvic bone and then we take out the bone marrow, which is the fluid inside the bone. The pure stem cells, once they are ready, a thin needle is inserted into the lower back. We inject the stem cells into the cerebrospinal fluid. It flows all the way up to the brain.
Things that would have taken probably years to be accomplished in my sons, in like 8 months' time, we've really been able to come very far.
They used to defecate on their clothes, but now they can use the toilet. We've seen a lot of improvement in terms of spitting. The tantrums have reduced. Sleeping used to be a problem before, but at the moment, he's taken to his bed, it takes a few minutes, and he's asleep.
See my son's cycle. You try to make them understand what it is to pedal, and they couldn't. But after stem cell, when we arrived in Kenya the following day, and we went out, and these guys could cycle. I'm going to send you to buy tomato paste, okay? I'm going to send you to buy what? In the shop. Where is the shop?
It's here.
Okay. So I'm going to give you
Money.
for what?
Buy tomato lollipop. I'm going to wear my shoes. That's right.
Parents ask me, so do you really think stem cell works? And I'm like, I can see changes, I can touch, I can feel, I can smell. Of course, for me, stem cell works. I'll do it until my children get well.
So that was a mother with triplets having autism, very severe autism. This movie is about 2 years old. I've seen them recently, and one of them is completely off the spectrum. The other two are very close to getting off the spectrum. They're living normal lives now, and it's amazing to see the wonderful improvements in these 3 children. This is one of our earliest, children we treated from India. He was very hyperactive with very poor understanding.
Shantanu was my first child, so I was very excited about how he would be. But when I came to know that my child has a problem, it shocked me and I wondered why did this happen only to me.
Shantanu's behavior was very different from that of other normal children. For example, normal children walk on the feet, but Shantanu walked on his toes.
It has been 2 months since Shantanu's stem cell therapy. There have been many changes and many improvements. His hyperactivity has reduced drastically, and his attention span has improved a lot. He sits patiently in one place. He has started coordinating with his sister very well. He plays with her very affectionately. We are glad we took the decision to give him stem cell therapy. It has been 6 months since the stem cell therapy. Shantanu has shown a lot of improvements. His hyperactivity is almost as good as non-existent. His handwriting has become much better. His eye contact has also become better. I have never seen Shantanu dancing, but now he takes a keen interest in dancing. He also likes to listen to music. He can now fold clothes. Earlier he was not able to fold even a handkerchief, but now he can easily fold blankets. He helps me in cutting vegetable and in cooking too. Goes to the market store for purchases. He passed his 10th grade.
He passed his school, he's now in college.
There have been improvements in many other aspects as well. For example, this emotional quotient has also increased. Now he hugs us very affectionately, calls me mother. Now he takes tuitions of other special kids.
He is now taking tuitions for deaf children. A child who could not speak after stem cell therapy now takes tuitions and teaches deaf children. So that is what is possible. And we'll skip the other videos. We'll now come very briefly and look at a couple of other conditions. We look at cerebral palsy. So in cerebral palsy, there is damage to the brain due to lack of oxygen at the process of birth. And the difference between cerebral palsy and autism is in autism, the deficiencies are in higher function, in speech, in behavior, in understanding, attention, concentration. In cerebral palsy, the problem is more physical. There is weakness of the limbs, or there is tightness of the limbs. There is inability to walk, inability to use the hands. And there are different types of cerebral palsy. It could be just one side called hemiplegic, or different types, just the legs, the entire body. So depending on where the damage is, you have different types of cerebral palsy. And this is just a scan to show you that the damage, as you can see, as compared to autism, you can see it is darker, it is larger. So the damage in cerebral palsy is significantly more than the damage in autism. There are certain medical treatments available. We have anticonvulsants to prevent seizures. We have antispastic medications, etc. And there are different treatments that help in the tightness. There are also certain operative procedures, both orthopedic and neurosurgical, that can partially help them. But none of these correct the basic problem in the brain. So, but when we give stem cell therapy, and now we've treated almost 2,500 children, this is data from 660, when 91% of the children improved here, the significant, that means going close to normal about 20%, moderate is 41%, mild improvement is 30%, 9% did not improve. But here, we did not see an age correlation. Here, the children with lesser damage had more significant improvement. Those who had more severe damage had moderate, mild, or no improvement. So 91% of the children improved, which is significant because otherwise there is no way these children can otherwise improve. And these are the symptoms that improve. They have drooling of saliva, oromotor, that settled their balance, trunk balance, upper limb, lower limb movements, the tone or tightness of the muscles, ambulation, all these improved. And this is a scan before. You can see the blue area above is the damage before. You can see it is on both sides and more extensive. And after stem cell, you can see it is significantly reduced. Here again, on the left side, you can see the damage before, and you can see on the right-hand side that the damage is significantly less as compared to the left-hand side. So this is what stem cells have done. You can see the damage before we gave stem cells, and you can see that the damage is resolved. Obviously, once the damage resolves, there will be physical improvements as well. And our work is published in this paper, clinical study using autologous bone marrow cells in Cerebral and New Frontier. This was not the world's first paper, but it was one of the earlier papers. And we have several more articles on stem cells in cerebral palsy. And here's a video of this child from, Kenya, who you can see was completely wheelchair bound, almost no movements of the hands and legs. And now you can see the changes after stem cells. So before you can see wheelchair bound, now you can see he, from being totally unable to use his hands, he can now actually wear and take off his clothes. He's able to pack his bag. He's able to stand, open the refrigerator. See, he could not even get off the wheelchair. And not only is he standing, he could actually open. And now this is so important for the mother. The fact that he can open a fridge and actually take out water. And there you can see that today, after stem cell therapy, this child is walking independently. A child who for so many years was totally wheelchair bound is today able to walk without any assistance, and he's independent. So this is the miracle of stem cells. Now muscular dystrophy, that's a condition where the muscles weaken because of a defect in the protein. And this is just to show you at 5 years, this is a MRI of the muscles, the thigh muscles. And the gray is normal. You can see at 5 years it's gray, and then as you can see over the years it becomes less and less gray, more and more white. White is fatty tissue, and by 16 there is almost no muscle. This is a condition called Duchenne muscular dystrophy. So you can see at 5 years, this is normal, and you can see at 21 years there is almost no muscle. All these children, 100% of them, they die by about before 25 years. There's 100% mortality. But with our stem cells, we are able to save their lives. We have children who've gone way beyond 20s, who have lived beyond 30s as well. So we know that we are able to save their lives. So muscular dystrophy, especially Duchenne muscular dystrophy, stem cell therapy is life-saving. And this is our data from 1,500 patients, 85% result. The significant improvement is only 4.5%, but moderate is 35%, mild is 20%, 14% remain the same. What you have to understand is if they had not gone stem cell therapy, all of them would have deteriorated. In fact, they would die. So when you say significant, mild, moderate, or even stable, this itself is also an improvement. And this is a comparative study we did. Patients who were treated with stem cells, you can see that this is how they stabilize. This is a graph called a Kaplan-Meier graphs that projects what will happen. So this is the ones who did not take stem cell therapy, and you can see that this would be the deterioration. So there's a big difference between those who take stem cell therapy and those who would not, who would deteriorate like this. And this is MRI evidence. You can see above, you can see this is all white. There is no muscle here before stem cells. And after stem cells, the same child, you can see muscle has come back. There is muscle regeneration. And here is something called M.Ch, which shows a very weak contraction. And after the stem cells, there is a dramatic increase in the muscle contraction. And we have 18 scientific papers on this. So here is this boy from California who had Duchenne muscular dystrophy. He had not stood for 2 years before he came to us, could barely crawl, and let us see his improvements. He was totally wheelchair bound, could barely crawl, and he's from California. You can see this is how he was before, and now you can see afterwards. So after stem cell, you can see he's standing. Okay, he had not stood for 2 years before he came to us, so now he's standing. and now he is able to walk with support. First, heavy support for walker, and soon he's able to walk with lighter support, for parallel bar. And now you can see that he's walking without any help indoors, and now he's walking outdoors without any help. And he got the opportunity to meet President Obama. So he visited the White House, and there he is with President Obama, who wanted to learn about his improvements. So then very briefly, intellectual disability. This is a condition. Here you can see the brain damage is less severe than cerebral palsy, slightly different from autism. This is our data from 247 patients, and 84% of the children improved, 20% significant, 25 moderate, 39 mild, and 30% didn't improve. So what improves in intellectual disability is their memory, problem solving, understanding of relationships, social inhibition, and toilet training. And this is a scan before. You can see the damage before. It's slightly different from how it is in autism. And after the stem cell, you can see the damage is almost completely gone. And the world's first scientific paper on the role of stem cells in intellectual disability was published by us in the journal Stem Cell Research and Therapy. We published this paper. We have 3 other papers on stem cells and intellectual disability. So here is 26-year-old female from Mumbai who had intellectual disability, and you can see the changes afterwards. You can see writing has improved, copying has improved. You can see on the left how difficult it was for her earlier, and you can see on the right how fast she's drawing, and her coordination is improved.
Very nice.
In fact, she won.
Smells good, looks good, and with stew, perfect combination.
She won an award in a cooking competition. So that is the improvement after stem cells. Spinal cord injury. This is what happens during road traffic accidents or fall from heights. The spine gets fractured. And this is our data from over 1,000 patients, 24% significant improvement, 56% moderate, 15% mild, and 3% did not improve. So here the legs get paralyzed. If it's the lower spine, they cannot move both their legs. It's called paraplegia. If it's the upper spine, they cannot move their hands or legs. That's called quadriplegia. So these are the symptoms that improve from their tightness, their bladder control, trunk control, postural hypertension. And this is our work on lumbar spinal injury, original study published in the Journal of Neurorestoratology. We have many other papers on stem cell therapy in spinal cord injury. And here is this story of an Indian soldier who was shot by terrorists when he was totally paraplegic. He could not even sit when he came to us, barely sit, and he was bedridden. And you can see afterwards, first he developed sitting ability, then you can see afterwards now he's able to much faster move by himself, and he learned to transfer by himself from a wheelchair to a car without any help. And now you can see that he is walking independently. And now this is an older video. Now he's able to walk. He was awarded one of the highest awards for bravery, the Shaurya Chakra, at the hands of the president. He also won a shooting championship pre-nationals, and he joined back to active duty in the Indian Army. It's very difficult when you're a bullet injury which has paralyzed you to join back active duty. But after stem cells, he improved so much that he could actually join back, and he is now back serving in the army. Brain stroke. This happens when there is either decreased blood supply or a brain hemorrhage on one side. And this is our data from 120 patients here. 51% had significant improvement. Only 3% did not improve. And this is a scan that shows you the damage before, the blue that you see, and afterwards you can see that the damage has resolved almost completely. These are our papers in stroke. Then in head injury, this happens because of road traffic accidents. And again, here you can see 29% had a significant improvement. You can see the scan before the damage and afterwards there is no damage. And this work is published in a scientific paper in Springer Plus, and we have several other papers as well. So motor neuron disease in America, this is called ALS. This is also a near fatal disease where 90% of the people die within 5 years. There are no known treatments for this. And this is we did what is called a control study where we compared patients treated with stem cells who stabilize like this to patients not getting stem cells who continue to deteriorate like this. And this work is published in the American Journal of Stem Cells. And we have 8 other scientific papers on this. So here's one of our doctors, Dr. Himangi Sane. She was a doctor in America. She got her MD from NYU, New York University. She was working as a consultant in America when she developed motor neuron disease. She went to the best doctors in America. She went to Johns Hopkins, everywhere. They all told her you have only a few months to live. But she didn't give up. She came to India. She approached me. I treated her. It's now more than 10 years. And not only has she not deteriorated, but she's improved so much that she now works as the head of her research. So let's hear what she has to say.
I am Dr. Himangi Sane, a graduate from Seth G.S. Medical College and KEM Hospital, and MD from New York Medical College. I was practicing as a consultant in New York when I developed motor neuron disorder. I started deteriorating neurologically, and so I consulted the best doctors in America, including Johns Hopkins, who told me there was no hope and this was a fatal disease. Then I came to India and approached Dr. Alok Sharma, who treated me with stem cells 10 years ago. After stem cell therapy, there has been halting of disease progression and improvement in speed, swallowing, and stamina. I have improved significantly and now working as head of research at NeuroGen Brain and Spine Institute. It is my request to all my medical friends and colleagues to please consider stem cell as a treatment option for incurable neurological disorders. I am a living example of the potential and power of stem cell therapy.
So, Dr. Himangi Sane, consultant, MD, internal medicine specialist. Had she stayed on in America, she would no longer be with us because America, they don't do these treatments. She came to India and she's alive 10 years later. So this is what stem cells do. Okay, they offer a new hope and lease of life. Now, a question that all of you must be having in your mind, okay, well, Dr. Sharma is telling us all about the good side, but are there any complications? How safe is this treatment? And there's good news here. We have no major adverse events. So now we have treated a total of more than 10,000 patients so far. Over 12 years, 10,000 patients. And we've not had any major adverse events or irreversible complications. No patient has deteriorated neurologically. But we do have some minor adverse events. Minor are those which are reversible. So 3% of the children who had history of epilepsy, they had epilepsy after the treatment. I'll repeat again. Those who already had a history of epilepsy, well, they sort of, within 2 months of the stem cells, developed epilepsy again. It's a small percentage, but it must be noted, and we've published this also. Those children who've not had epilepsy, there is no danger of this at all. So this is only a 3% risk in those who have epilepsy. In those who don't, it is 0%. 10% of our patients after the treatment may get a headache which lasts for 2 or 3 days, which is in the hospital itself. It never happens when you go back. And this is a peculiar headache. It goes away on lying down. It only comes when the child sits. So that happens to some of our children. A few may have a little feeling of nausea or vomiting, but all these are reversible and they are not very severe. Now, the last part, so I spoke about stem cells, I spoke about all the different types of rehab, and the last part of our armamentarium is integrative therapy. So, integrative therapies are therapies that enhance the function of the brain and body as a whole. So we are using all these different types of equipment, from hyperbaric oxygen to ozone and cryo and infrared. So we have a combination of therapies, and we're going to talk about all of them. We'll talk about some of them. So hyperbaric oxygen, we all know as HBOT. Basically, our blood consists of fluid called plasma and red blood cells and white blood cells. Now, at normal, when we are breathing normally, all of us, we breathe at 1 atmosphere, and only the hemoglobin in the red blood cell can carry oxygen. But when you go into this chamber and oxygen is given under pressure, the oxygen enters the plasma, the liquid. So every nook and corner, every cranny of the body gets oxygenated plasma, which is very good. And it particularly helps the brains of children with autism and cerebral palsy. So this is just a technical slide that actually shows how hyperbaric oxygen, through angiogenesis and various other changes that happen in the mitochondria of the cells. So it's a technical slide, maybe a little difficult to explain to you, but there is a science to show how this helps in both autism and CP. Ozone therapy is also, oxygen is O2, ozone is O3. And it's ozone is a very powerful gas that can be given in different ways. It can be given, you can inhale it, it can be given through the ears, you can sit in a chamber and your whole body gets it. And we found a lot of beneficial effects of ozone on our children. And what we are finding is that when we combine stem cells with ozone and hyperbaric oxygen, the clinical results are faster. So earlier, when we were doing only stem cells and rehab, the results that we got in 6 months, when we combine it with hyperbaric and oxygen, we are getting in 3 months. So there's a faster recovery with this combination. We also believe in gut cleansing, and because a lot of kids have gut problems, so we work on the gut itself. We have various kinds of ways in which we can do that. We have different other things like cryotherapy, infrared, etc. We use high dose vitamins and antioxidants. So these are various parts of the integrative therapy program. This is the institute where all this work is done. It's called the NeuroGen Brain and Spine Institute. It's in Navi Mumbai. It's been set up for this purpose only. So far, we've treated more than 10,000 patients from over 70 different countries from all the 6 continents of the planet. So patients have come to us from every corner of the world. This is our core team. Apart from myself, Dr. Nandini and Dr. Prerna are the stem cell experts. Dr. Jacob is India's senior most and most respected physiotherapist. He overlooks the rehab program. And you just heard Dr. Hemangi Sani talk. She is a physician and survivor of ALS and looks after our research. We believe in quality control. So our laboratory is GLP, GMP certified. We have an ISO certification. So we are very, very particular that we get the best quality treatments. This is our stem cell lab, which is among the finest equipped in the world. We are accredited by the European Medical Association, the EMA, for best medical practices. So this is an important accreditation which we've got from the European Medical Association. We have published a total of 18 books. We have received numerous recognitions like this very prestigious, the Rose of Paracelsus Award, which comes from the Socrates Nomination Committee of Oxford. We received the European Award for Best Practices from the European Society of Quality Research in Brussels. This is given for front-end pioneering research. We received this Bharat Gaurav Award was given to us in the British Parliament for exemplary work done. We got the Best Stem Cell Therapy Center Award in 2016 at the National Healthcare Excellence Awards. And we got the award again in 2018 from our Minister of Health. the best stem cell therapy center in our state. Now, to help you make the decision, you could visit our website, which is neurogenbsi.com, and you get all the information on this website. You could send us an email, and our response time is less than 30 minutes. So when you send us an email, you'll get an instant reply. You could set up a WhatsApp chat, audio or video call, or you could call this number. You could also set up a Skype or WhatsApp video interview with a prior appointment. All the people who have attended or registered for this webinar can get a free discussion with me on a one-on-one, which can be arranged, and the people coordinating who've arranged this webinar will help to set it up so that you can have a one-on-one discussion with me after this or anytime later. Once you've decided you want to do the treatment, a coordinator is appointed who will become your one point of contact for everything. And this coordinator will assist you through the entire process till you come to NeuroGen. And what happens is you need to arrive on a Sunday only. We have admission only one day in the week, that's Sunday. On Monday, all the evaluations happen. Tuesday is the day when the stem cell therapy is done. Wednesday to Saturday is all the rehabilitation. And Saturday you are discharged and you can go home. Now, is it easy and safe to travel to India during these pandemic times? So we just have a little video of one of our patients who traveled to us from Zambia, and she will share her experiences of traveling.
My full name is Lorraine. I'm from the Banda. I use Banda because I'm married. I am from Kitwe, Zambia. Zambia is a country in Africa, Central Africa. That's where I am coming from. I came on the 27th of November from Lusaka, Zambia, via Dar es Salaam in Tanzania to Mumbai, which is in India. I brought my son to the NeuroGen Institute, Brain and Spine Institute in Maharashtra. From Zambia to India, I traveled safely. All that is required, should I say, for a person around this time of the COVID travel is to have the COVID certificates, which I did. We managed to get them on time to travel. So traveling from Zambia to Dar es Salaam was all right. They did not ask a lot of issues other than the exemption certificate from the NeuroGen Center. That's the very most important document. That one has got to have in order to travel. Otherwise, they don't allow anyone on the plane. So once they saw that one from Lusaka, Zambia, they asked the same. Even in Mumbai, when I arrived, it was the same. The NeuroGen team have been very, very excellent in as far as giving documentation is concerned. They are efficient. They produce the information right on time. They never delayed. In my preparations, I have been on time. The NeuroGen Institute, the NeuroGen Center, is very, very accommodating staff. In my country, they are just giving visas for medical travel. It doesn't matter where you are going, but it has to be a medical visa. That medical visa is issued to the person who is traveling, who is sick, as well as the attendant for attendance. So the airports are not congested as before. The airports are just okay, but still there are a lot of people traveling.
So just to conclude, so what is different about us? First, we have the largest number of scientific papers in the world. When different editors of books want to write a chapter on stem cell therapy, they ask us to write stem cell therapy for neuro conditions. There must be some reason why they do that. We are the only stem cell therapy center in the world that does neuro cases exclusively. All the other stem cell therapies in the center, they do orthopedics, cancer, cosmetic, everything. We do only neurological. We use the safe autologous cells taken from the own body. We inject them intrathecally, so it reaches the brain directly. We have we combine it with comprehensive rehab. We've treated over 10,000 patients from 70 different countries. We have a team of very senior and experienced professionals, and we are constantly researching, what can we do that's better. All our work is approved and monitored by a government-certified institutional ethics committee. So it's very important. So there is an oversight to our work. We're not just doing what we're doing randomly. Our work is oversighted. So my conclusion is that adult stem cells, what we use, are safe and effective. And notice I've said safe before effective. So they are safe and effective treatment option. They're a treatment option. Okay, so it's a choice you have to make for children with autism, cerebral palsy, and some of the other neurological conditions that I've mentioned. I'd like to end with quoting Mahatma Gandhi, who said, "To believe what has not occurred in history will not occur at all is to argue disbelief in the dignity of man." Just because something has not happened in the past doesn't mean it will not happen again. And we heard the Prime Minister of India speak in Parliament about stem cells. And let's hear a president of America talk about stem cells in this next video. So again, to show you, this is what we are doing right now, rehabilitation on a broken, on damaged tissue. And what we should do is rehabilitation on repaired tissue. So let's see what...
Scientists believe these tiny cells may have the potential to help us understand and possibly cure some of our most devastating diseases and conditions, to regenerate the severed spinal cord and lift someone from a wheelchair, to spur insulin production and spare a child from a lifetime of needles, to treat Parkinson's, cancer, heart disease, and others that affect millions of Americans and the people who love them. Today, with the executive order I am about to sign, we will bring the change that so many scientists and researchers, doctors and innovators, patients and loved ones have hoped for and fought for these past 8 years. We will lift the ban on federal funding for promising embryonic stem cell research. There's no finish line in the work of science. The race is always with us. The urgent work of giving substance to hope and answering those many bedside prayers, of seeking a day when words like terminal and incurable are potentially retired from our vocabulary.
So with that, I'd like to, end this webinar. We have a short film, the film that we missed out earlier. The child from America, whose father is a cardiologist and mother is a nurse. And we'll show you a very short film on what it is like when the child is diagnosed, when you hear about stem cells, when we did stem cells in the child, and what improvements he had. So let's just see that short film now.
He was screaming, he was crying, I was trying to hold him, and we were like 45, 50 people on that bus. And it was 2.5 hours drive each way on the excursion. So on the way back, this woman just let it go. Would you shut up? I felt like a bullet went through me. I just thought, wow. I was like, oh, and I just said, my son's autistic, he can't help it. He really can't help it. And then you could hear a pin drop. Ganesh was born in December of 2003. We were so excited about his birth, and we had lots of family there and friends there. It was just delightful. He was very responsive, very happy baby.
We knew he was extremely spoiled. He always wanted to have his way. He was the apple of their eye.
Snake.
At 1.5 years old, he was a fluent reader.
Singing a song all day long.
He knew the alphabet and he knew the sound. There were some things about him that were kind of extraordinary.
he was sitting on the kitchen floor and I was doing dishes in the kitchen, and I just kept saying to him, Ganesh. I kept calling his name and he would not look at me, and which was very different for him. I couldn't get him to engage with me. I couldn't get him to give me eye contact. And I noticed over time, he started to lose a lot of vocabulary. About around 18 months to the age of 2 years, he just slid backwards.
He would flap like that, and he would walk on his tiptoes, look at the wall and be talking to the wall. Or he had problems with eye contact. He'd never look you straight in the eye. He'd look like that. His speech was not very fluent. So he would say, oh, cheese. He'd get the last part of it right, but not the whole part of it. He had problems with his speech.
He wouldn't even allow us to put the food in his mouth, and he would just be screaming, get away from me, and stop hurting me. We were just chasing him with food constantly. We would get some of the other kids, and we would corner Ganesh, and we would force feed him. And it would be painful to do, kind of seemed cruel as a parent, but we knew that if we didn't have him eat something, then he would have just this huge tantrum, and we all would be just horrified.
When he was 5, he was in school, and his teacher asked him to do something, and he didn't want to do it, and he had to have his way, and the teacher wouldn't let him, so he ran across the room and kicked her. And that's when she called and said she couldn't take care of him, that there was something wrong, to get him checked.
Child psychologists insisted that Ganesh was not autistic. They suspected they didn't have a real accurate assessment of him. And I remember the doctor saying, oh, no, you don't have to hire a speech therapist. And I said, yes. I feel like I need to. He's lost so much vocabulary and I don't understand why. So when she came in, I did not know her. She didn't know any of us. And the first 15 minutes, her eyes were just big, and she kept watching Ganesh, and she kept asking me, how long has he been doing this, and how long has he been doing that? And Ganesh was getting up every 2 seconds and running around and not wanting to do what she had asked him to do, and not wanting to engage at all. The speech therapist said, you have to know your child is autistic. I closed my eyes and I just felt like a million bricks falling on my head. I just felt like that was the worst thing she could have said. Everything that she had said was exactly the behaviors that we had been seeing, but we were just dismissing. We didn't want to see, we didn't want to, I guess, to think of our son as being, autistic.
I did a lot of research, did a lot of studying on the internet and books, and there's no treatment, as we know, and we have to figure out a way to help him out. We tried homeopathy, and I tried it for about 3 months, and I couldn't tell a difference.
We got him started on all kinds of supplements. We kept him on a gluten-free, casein-free diet, occupational therapy, speech therapy. I started art therapy with him. We did music therapy with him.
All of that seemed to help some. It seemed to calm him down some, but it wasn't making the problem go away. And the problem was he could not attend to things. He didn't have eye contact. He didn't have attention span.
We were just so frustrated because he didn't seem to be making progress.
Did some research and found out about stem cells being done in Mexico and Panama. I wasn't too keen on doing it because they take cord blood from a newborn and inject it IV into your child, and you don't know what you might be getting into.
I hadn't read too much about stem cell treatment. This was another one of those therapies that someone had sold us on. It was a lot of work, and perhaps we would be let down again. So I was really worried about that.
And that's when I found out about NeuroGen. And I spoke to Dr. Sharma. There was sometime in April of 2015. And the big question that I had in my own mind was, what is there to lose? And I could not come up with a good answer, and I said, we have to do it.
They were so polite and so kind and gave us lots of information. So we decided to try it.
Ganesh had some hesitation about coming to India and going to a hospital in India. The hospital is entirely built to American standards.
Our experience was positive. We were treated like family. We were treated so beautifully. Everyone was looking out for Ganesh. He would wander off, or he would do something quirky, and we were accepting. They were loving. They were embracing him for who he was.
The first stem cell treatment was December 2015.
I think as a mother, when you hand your child over, you have to trust someone with your child. You know, hand them over for the stem cell treatment that morning. That we're concerned, that we're worried, am I doing the right thing? You know, what's really neat about NeuroGen is that they really put very necessary emphasis on therapies that you have to have in place.
You want to do stem cell, but you also want to do occupation therapy, physical therapy, speech therapy, behavior therapy to get the child back into the mainstream.
We started seeing better eye contact, definitely a difference in his engagement with us, with his siblings. Teachers were commenting, well, we can tell a little bit of a difference in Ganesh and what's new, and do you think this is the stem cell treatment? And we were like, that's the only thing we can attribute it to. And then things just gradually seemed to improve overall. His mood, he was so much calmer. There weren't these horrific tantrums. They were decreasing, and when he would have a tantrum, I could talk him out of it. I could engage with him, and we could problem solve. He was able to sit at the table with us. He was trying new and different foods, put the food in his own mouth, and do it consistently. So as a parent, it's very exciting. He loves popcorn. He really enjoys to make it himself now, which is new. It's a big thing for him. Of course, we're delighted for him.
Very nice. I like how you did that.
Now he's all about taking his own shower. I have to just prompt him to get out. But he'll wash himself and he'll put his clothes on. It's very exciting. Because of his sensory issues, he could never wear anything besides shorts and a short sleeve t-shirt. So now he's able to wear long pants, which is cool. And he's gone from only wearing Crocs to now he'll wear tennis shoes. It was always a joke that he'd go outside and he'd just take all his clothes off. It didn't matter who was in the house, who wasn't in the house. It didn't matter who was outside. But now it's not the case.
Can you speak some languages?
Yeah, different languages.
Like?
Tell them. Like Hindi, Tagalog, Arabic.
How do you say Carolina in Spanish?
Hola, ¿cómo estás?
It was refreshing. It was exciting. We were seeing new and different things all the time. So it's almost like that window of opportunity reopened for Ganesh. And Ganesh has gone from the third grade 4th month reading level to a 7th grade 1st month reading level in 5 months.
This is the first time since his stem cell that he has gone to a regular school.
After ABS last year, I started going to green, and then I will do a good job in green.
It was as smooth as silk. He started to run. He followed his schedule with help from the teacher. He learned his schedule from the first day. For his first report card, it was all A's. He's doing all the work. He's pleasant. He's correcting his errors. He's learning from the mistakes, like on the reviews, and getting the answers on the test questions with like 90% accuracy, which is amazing. He would get off the bus by himself. He did not want me to come down and meet him. He walked 2 blocks home and he would come inside the house.
I like to ride the bus home and ride the bus back. I don't know back to school.
These things seem minuscule to some people, but to us, it was a huge victory.
Every time he goes someplace, to his grandparents, to school, to wherever, people say, oh, he's a different child now. He's a lot calmer. He's talking normally, and he looks like he's grown up.
So he was taking a musical class. He was playing 4 instruments with a group. And then they had a recital. It was amazing. We chose to come back to NeuroGen for the 6-month follow-up. When we saw the PET scan images, I can't tell you, we were just so excited and thrilled. The areas that were hyperactive or non-active were warm. There was activity there. So my husband's board certified in nuclear medicine. So as soon as he saw the images, he knew. He's like, come here, you have to see this. So that moment will always be, a memorable moment, because we had that validation, like this was worth it. I would thank NeuroGen a lot for their service, for them persevering, because it is new. It's a new opportunity, and because the research is building. And I appreciate that they are so driven and they're so ambitious for these individuals. They seem so dedicated to that patient. Dr. Sharma had mentioned once, he said, I've asked my staff to treat everyone as if they're my family. And I feel like that is true what they've done. People think back in America, how could medicine be as good or better in India? When you're here, when you understand, when you're around and when you read and when you know, I've really grown to know and appreciate caliber of medicine here is by far, it's loving. Here, the more private perhaps, the more individualized, we don't have those options there.
NeuroGen is awesome. The staff's awesome. Dr. Sharma is awesome. Dr. Nandini, everybody's awesome. We love NeuroGen.
I want to thank NeuroGen for giving me the last stem cell. Thank you.
Words of wisdom for parents who have a child that has been diagnosed as being on the spectrum is very simple, very straightforward. Get evaluated for stem cell therapy. This offers the potential for a cure. There's not anything out there that comes even close. I have seen a dramatic improvement both clinically and on the PET CT on my child, and it's unmistakable. It has been a game changer.
President Trump, you are a good president. What I like about you, President DT, make America greatest again. You're awesome.
He was always adamant about Donald Trump should be president of the United States.
Yes, only Donald Trump.
Ganesh is absolutely a delight to be around. I learn something from him every single day. The biggest thing that I've learned from him is how to take adversity and turn it around to something that's positive and bring something of joy out of it.
Just wants to be happy, and he's so much happier within his own skin. If we can say that. I say, Mom, I love you. And those words had never been out of his mouth before. In Ohio, places where I can take my child and be myself, and be a family, and be accepted. We go to dinner, and people come over and say, you know, I love that you bring your son to a restaurant. And that to me means so much, because you're so tempted to stay at home. You're so tempted to just hide and not show the pain, not show that he's so different. I want him to be independent, of course, and as a mother, I would love him when his wings are ready, he can fly, but he can always be my baby boy.
What stem cells do is they improve the functioning of the brain. And so, even if there's a malformation all over, it will improve its functioning. I'm not saying that the pachygyria will go away, but the brain cells will work more. They will be more activated. And when the brain cells are more activated, you're going to see more clinical improvements. So the answer to your question is that yes, stem cell therapy can help, and we have treated several patients of pachygyria. Anonymous attendee, hello, it is so good to see Dr. Sharma. My son had his first shot of stem cell therapy at NeuroGen Mumbai in November of last month. We are seeing steady improvements until recently when we were observing tantrums, anger, and gut issues. We did IG and found food intolerance issues and gut fungus. Could this be related, or is the stem cells working in the body? So you have to understand that the food intolerance and the gut fungus was obviously there in the body before the stem cells. And we know that 9 out of 10 children, that's true, 9 out of 10 children with autism have gut issues. And there is a direct connection between the autism and the gut issues, like I mentioned before. So the improvements that you are seeing, the steady improvements, like the tantrums, anger, and all that, I'm assuming they are because of stem cells. Yeah. So if the question you're asking is, are the gut issues related to the stem cells? No, the gut issues were present much before we did the stem cell therapy. Now, what we have found is that because you've done this recently in November of last year, I would think. Now it takes 3 to 6 months up to a year for the gut issue to settle. So we had several children who had gut issues, like they would eat like anything. They would eat toothpaste and powder and chili and eat their own poo and eat mud. And we had a child who would even eat glass, would break glass and eat it. And what we found is after the stem cell therapy, the gut issues gradually started getting resolved. So yes, with our stem cell therapy, we have seen an improvement in the gut issues as well. Michael Masri asks, are the stem cells taken from the father or mother or from the child himself? Michael, the stem cells are taken from the child itself. We use stem cells from the child's bone and put it back in the child. We do not take from the father or mother. Michael Masri asks, what is the perfect age for this procedure? So there is nothing like a perfect age for the procedure. But the earlier we do it, the better it is, like I told you. Our limitation is not age. The child needs to be more than 10 kilograms of body weight. So we can't do the procedure if the child is less than 10 kilograms of weight. Age is not of consequence. The youngest child we've treated, not autism, but of an accident, head injury, was 8 months old. The baby had a road traffic accident and we treated an 8-month-old child. In autism, we have treated kids who are 2 years and more. So there is no perfect age, but the earlier we do it, the better it is. Now Sam asks, is there an upper age limit to go through for stem cell therapy for autistic kids? My child is 10 years old, does it help him? So there is no upper age limit. We have treated children from 2 years. The oldest autistic child I've treated is 38 years old. Not a child actually. So there is no limit to, there is no upper limit. Since your child is 10 years old, he's going to attain puberty fairly soon. So it would be better because like our data showed us, when we do the stem cell before puberty, the results are better. So if you would like to do stem cell therapy, the time to do it is now because the results you would get now would be much better than the results you'll get after 1 or 2 years. So at 10 years, yes, the answer to your question is yes, it will definitely help him. Angela Dugan asks, do you have partnerships for the US for this type of cellular therapy? Traveling outside the US is a challenge for most families. Well, at this point, we do not have partnerships in the US. So at this point, all you can do is you'll have to, if you want this therapy, you have to come to India because it is not available in the United States. Then Angela Dugan also asked, how often do you need to do the procedure? So this depends on the degree. So there are 3 types of spectrum disorders: mild, moderate, and severe. What we find is if the problem is mild or mild to moderate, then it responds to a single treatment. If it is moderate, then you need 2 treatments. If it is severe, it may need 3 treatments. But never, we don't need more than that. So all this depends on the extent of brain damage. And that we will know when we do that PET CT scan, that color scan I showed you. When we do that, we'll get a better idea. Then Maithili Rajesh asks, we are interested in SCT for my son. I would like initial consultation with Dr. Alok Sharma. Dr. Sharma, please let me know the process. Maithili, we will, what is the process for people who want to consult me?
If they want to consult, yeah, so they can reach out to us. And
where? Reach out where?
They can reach out at the double line number.
Okay. Actually, we will be getting back to you. All of you, your names and numbers are registered with us. So we will get back to you and we will set up an appointment. And then you'll be able to have a discussion with me. So we will let you know the process shortly. Yamini Thakur, I want to ask, does antibiotics and the dye used affect the kids who are on mitochondrial supplements and B12 levels of the kid? No, the antibiotics and the dye used, they do not affect, they don't have any effect on the mitochondrial supplements and B12 levels. So they do not. And we can use that. The antibiotics that we use are the ones that are safe and have no harmful effect on the kids. Anonymous attendee, will there be a way to get a copy of the PowerPoint? We can have that maybe email to you, but you are an anonymous attendee. So if we knew your name from our record, we will find a way to get this to you. However, this is available, the whole recording. Where? On the email address we share. So on your email address, you will get a copy of the entire video presentation I made. So not just the PowerPoint, but the entire presentation will be emailed to you. Now, Lydia, can this be done on a 3-year-old child with autism? Yes, we can do it. 3 years is a very good age to do. So the answer to your question, Lydia, is that we can do it on a 3-year-old child with autism. Asha Thanki asks, does SCT work for epilepsy? No, the answer is stem cell therapy does not work for epilepsy. In fact, if you saw the complications, I said in 3% of the kids who have epilepsy, there can be an increase in epilepsy. So stem cell therapy does not work in epilepsy. I want to be very clear about that. Does it repair cartilage in the knee? Well, I believe it does, but I'm not an orthopedic surgeon and I do not do stem cell therapy for the knee. So I can only answer neurological questions, but I do believe there are others who do that. Are chelation, ozone, HBOT, and all the other therapies included in the treatment plan? So yes, all of this is included. When you come to us, all the HBOT, ozone, all of this is part of the treatment. It's not separate. It's all included in the treatment. It's a very comprehensive plan. Rekha says, Shraddha wants to ask, when do you have to do HBOT? Is it before stem cells or after? Also, if it is before, then should we stop before cells? When? And after cells, can we start immediately? So, those who have not taken HBOT before, we will be giving you HBOT when you come here. If you are taking it before, there is no need to stop it. You can continue it till before you come here. And after you go back, we will guide you as to what therapy to take. Yeah. So again, in case that answer was confusing, you do not have to do HBOT before. You can come to us as it is. We will do HBOT here. Point one. If you're already taking HBOT, please continue it. Okay. And when you come here, we will, decide whether we want to, give you additional or not. So, in summary, my answer to your question is whatever is going on, please continue it. Once you come to us, we will then decide what needs to be added or what needs to be continued. Kim asks a few questions. Is the child out to sleep for both extraction and insertion? Yes, the child is totally asleep. We give sedation, anesthesia, short acting. So the child is totally sleeping. They experience no pain. If the child is tube fed with milk, medical milk, are their cells healthy? No, there is no correlation between the feeds that are given and the stem cells. The stem cells are within the bone, and there is absolutely no correlation between the stem cells and anything that is fed to the child. How come the cells don't go back to heal the? How come the cells don't go back to heal the iliac crest? How come the cells don't go back to heal the iliac crest? Well, we are putting these cells into the spinal fluid in the brain. They cannot come out from there. So once we inject it in the CSF, this is a closed space. And the cells can only circulate within the brain and spinal cord. They cannot come out and they can't go to the iliac crest. I heard a recommendation not to do bone marrow till 40 and only 3 times in life. Can you talk to this? Well, that's not true at all. Like I said, we've done bone marrow on an 8-month-old child, and we've treated a total of 10,000 patients, several of whom are 2 years, 3 years, 4 years. So the bone marrow that you are talking about, that is a different kind of bone marrow. That is a bone marrow where the entire bone marrow is extracted from the child. And there is a chemotherapy given to destroy the bone marrow, and somebody else's bone marrow is put. That is done for certain cancers. So this is true for that. Here we are not extracting the whole bone marrow. We are just taking a small amount to separate the stem cells. So the bone marrow you are talking about is a very different bone marrow where we use chemotherapy to kill the bone marrow. This is not that at all. So you can do it. And there is no 3 times. You can do it as many times as possible, but there has to be a gap of 6 months between the therapies. Sophia says, are you familiar with CTNV1 syndrome and how stem cells may have a positive impact on this specific condition? Yes, we are aware of this, and we have treated children with this, and they will benefit. Now, what you have to understand is that in several of these, the basic problem doesn't get corrected, but the damage which has occurred to the nervous system and the musculoskeletal system, that is what gets repaired. So in many of these conditions, the fundamental problem is not corrected, but the damage caused is corrected, and you have good improvements. Have you seen improvements for children with periventricular? Kim asks, have you seen improvements for children with periventricular leukomalacia? Yes, Kim, we have. We've treated a couple of 100 patients with periventricular leukomalacia, and they've all benefited tremendously. Rekha asks, Shraddha wants to ask if the child with autism has autism, and how does his own cells repair the damage? Shraddha wants to ask if the child has autism, how does his own health? So the child has autism, there is a damage to the brain. Okay. Now the bone, the the stems, his own cells, are healthy. See, a child with autism has no problem except for that defect I showed you in the brain. The skin of the child with autism is normal, the bone marrow is normal, his heart, liver, kidney, teeth, everything is normal. So the bone marrow is also normal. So the cells we are taking are good, healthy cells. There is nothing wrong with them. Then Teresa wants to ask, my child does a lot of head banging and there are lumps on her head. Numerous allergies, desaturated oxygen at birth, C-section delivery, non-verbal, walked at 4 years. Will she benefit from stem cells? Also, can we give rifaximin daily on an M.Ch protocol? Should we stop it before SCT? So, okay, coming to your question, Teresa, my child, you said, has a lot of head banging and there are lumps on the head, numerous allergies. So, one of the amazing things we noticed, every single kid who had head banging, the head banging disappeared, didn't reduce, disappeared after stem cell therapy. For some reason, it works very well on head banging. That completely stopped. The lumps on the head, I mean, they are because of trauma and they will heal. The allergies, the stem cell does not affect allergies. Okay, I mean, it doesn't have a direct connection to allergies. It's only fixing the brain damage. But by and large, the parents tell us that those who seem to have various allergic illnesses, they reduce after stem cells. However, we cannot claim the stem cells do it because our stem cells are working on the brain. And you can continue. So your M.Ch protocol, whatever you are doing, please continue it till you come to us. We do not stop any treatment that is going on. Once you come to us, we will then tell you what to continue and discontinue. So whatever you're doing, please continue it. Carlos Ocu asks, Dr. Sharma, thank you for bringing hope to us. Does the stem cells recover a brain tissue that is dead due to hypoxia? Well, the answer is no. Whatever is dead, it cannot recover. Stem cells only recover what is damaged. So there are three types of tissues. There are normal tissues, they don't need anything. There are damaged tissues, which we repair, and there are dead tissues for which you can't do anything. So stem cells work on damaged tissue, not dead tissue. Would that help accelerate other areas in the brain to reassign these activities, or does it improve the area where the brain insult has happened? So like I said, where the brain insult has happened and there is damage, and how will we know? So that is where the PET scan comes. You know, on the MRI, you can't make out what is dead and damaged, but on a PET scan, you can. You can make out which part of the brain is dead and which is damaged. And so once you do the scan, we'll be able to give you a better idea as to, you know, what improvements that can expect. So, and then what we do note is that the parts which are not working, when the stem cells improve the damaged area, the functioning does get reassigned. So parts of the brain that were responsible for some other function get taken over by other parts of the brain. So we've noticed that. Our daughter has spastic diplegia, 6 years old. Well, she should do very well. We've seen with spastic diplegia, we've seen amazing results, and they do very well. They will, you know, get back their limb function, and we'll be able to get them to a life where they are independent and can take care of their own abilities. So we have excellent results with spastic diplegia. So Renu says, I'm a mother of a 3.7-year-old twins. My elder twin was diagnosed to be on the spectrum 6 months back, not started therapy due to lockdown. Started with homeopathy from 4 months, not seeing any improvement. He's non-communicative. With stem cell help, how much will it cost? So yes, stem cell therapy would certainly help. He's 3.7 years old. So at this stage, he will stem cell therapy will have a very, very good effect. And cost is something we don't discuss on the webinar. This is for educative purposes, but you know, you could be in communication with the hospital and they would discuss the cost with you. But stem cell therapy will definitely help at 3.7 years. The anonymous attendee asks, Shankar asks, do we need any metal testing before stem cells, as some centers are doing this? No, our answer is no, we don't need metal testing, because what we have found when we've treated a very large number of patients, and so we analyze the data. Those who had, you know, heavy metals in the body, those who had taken treatment, those who are not taken treatment, and we found that there is no difference in the improvements. So we are not doing heavy metal testing. It's not required from our treatment point of view because it doesn't change anything. Our daughter has hypotonic CP. Yes, you're right. A relatively lesser percentage of children as compared to spastic. Even though I've read parents' feedback that SCT has helped for CP, I did not specifically understand the experiences with respect to hypotonic CP. Can stem cells help? Of course, they can help. You have to understand stem cells don't help spastic CP or hypotonic CP. Stem cells repair the damage in the brain. They work here. And the hypotonia is because a different part of the brain is affected. The spasticity is because a different part of the brain is affected. Stem cells will fix that. And once it fixes that, the tone, whether it's hypotonia or hypotonia, both of them will improve because we are not trying to treat the tone. We are not trying to treat the hypotonia or spasticity. We are fixing the damage in the brain. So stem cells can definitely help, and we have treated patients with the hypotonic CP. Anonymous attendee says, can hypotonia be treated with stem cells? Yes, it certainly can be treated. Again, the anonymous attendee says, can you mention 10 kg as maximum weight? Are there exceptions like an 8-month-old child you mentioned? So, so 10 kilograms is the minimum weight required. Now, the 8-month-old child was a child of trauma, was an accident. It was an acute injury. They had a road traffic accident. Both the parents were doctors. And because of the acute nature of the emergency and the severe brain damage, so that was an exception that was made. That was more like an emergency where these conditions are waived. But electively, we don't. Farfali asks, my daughter is 14 months old and her weight is 7 kg. Can she be a candidate? No, we will have to increase her weight because at 7 kilograms, we cannot do it. So you will have to, improve the weight and bring it up only then, because this is a safety issue and these are part of our protocols which have been approved by our ethics committee. So we cannot deviate from that. I have a leeway as the physician that up to 8 kilograms, if the child is otherwise fit and the biochemistry is okay, and the condition warrants, we can do it up to 8, but the recommendation is 10 kilograms. What is the percentage of recovery? My daughter has severe CP. There will be a recovery now. What we can do is you can have a one-on-one discussion with me, and I'd like to see videos of your child, and I'd like to understand how she is, and then we can take a call on whether she will benefit or not. So it's difficult for me to make a statement about percentage of recovery because I haven't seen your child. I don't know any details. I've not seen any reports. But you can have a one-on-one discussion with me, and I'd be happy to give you accurate answers. Anika O'Malley says, I have to leave now. Thank you very much for this webinar. Very much looking forward to setting up a one-on-one. Our daughter has CP. I would love to have a copy of this presentation. Thank you so much. So Anika, you will be getting on your email, your registered email, you will get a copy of this presentation. You can also set up a one-on-one with me and we can discuss about your child. She has cerebral palsy and I'm sure we can help her. Lydia says, how come this treatment is not available in the USU? Is a regulation issue? Yes. So this treatment has developed more in the East. So the leaders of this are Japan, China, Korea, and India. These 4 countries have done the maximum stem cells for neurological disorders. In the in the EU and US, there are certain regulation issues. In America, they've started doing this now in some of the universities. But we've done many more cases than what has been done in the US right now. I believe in a couple of years it will be available, I think, all over the world. Jen says, I would love to have a copy of this presentation to show my husband and would like a consultation. So you will get a copy, Jen, on your email, and we will be communicating with you to set up a consultation, and I'd be happy to have a one-on-one discussion with you. Nishita has the following questions, but there are no questions written here. All right. Is it the case that once injected, most stem cells die? If it is true, then how much gains will we be able to see? It is not true that most stem cells die. We've done a lot of basic, so, between 1998 to 2008, for 10 years, I did a lot of basic experimental laboratory work with these cells. We worked with animals and we injected the cells and then we sacrificed the animals. We saw what was happening. So it's not true that most of them die. Some of them do, but not most of them. And we've actually seen, I showed you that slide earlier, where we've seen at 6 weeks, most of the stem cells were converted to brain cells. So you should be able to see. So that statement of yours is not accurate, that once injected, most of the stem cells die. If SCT is not visible in certain genetic conditions, the genetic makeup of the stem cells is also the same as the other cells. Then after injection, won't the new cells be faulty? So I understand what you're saying is if it's a genetic condition, will the bone marrow stem cells help? Now, what I want to say here is stem cells are not correcting the genetic problem. We are fixing the damage. So there is a damage to the brain by generating growth factors, by improving the blood supply, by the stem cells going there and converting to brain cells, by moderating the immune system. We are repairing the damage. Now, so the stem cells by itself, and we check them. We have, we have a cell counter. We check the quality of cells. We check the viability. We check everything before we inject them. And the stem cells we inject are healthy, good cells, and they do repair the damage that has happened. So it's not true that the new cells will be faulty, because we are just repairing the damage that is there through multiple factors, not just the stem cells converting. Like I said, there are growth factors, and there are various chemicals released, and there is blood supply improvement, and there is modulation of the immune system. There's prevention of cell death, and there's an anti-inflammatory effect, so on and so forth. Are there any negative effects you might have observed during the long term, say after 5 years? So I've been treating patients since 2008. That's over 12 years now. And we are following up patients that we've treated since then. We are still following up patients treated 12 years ago, and we have never seen any long-term side effect 12 years after the treatment. So I would say that if something has not happened for 12 years, it is unlikely to happen. After SCT, do we do rehabilitative therapies for the 6 months and the child may have some gains? Then if you take a break from the therapies, will the gains be gone, or will the child retain those? I mean, do we have to continue rigorous therapies for many years? So this is very individual. There are some children who need therapy for 6 months, and some who may need for a year, and some who need for 2 years, and there are children who need therapy for 3 years. So, but whatever gains have come, they don't go back. Even if you stop the therapies, you don't go back. There is no regression. So the answer to your question is, if you do rehab for 6 months and take a small break, your improvements may not continue. Like if after 6 months you continue rehab, your improvements will continue. If you stop rehab, it will remain where you are. It will not come down. So another question, is this effective treatment for CP? The answer is yes, it is effective for CP. Does the stem cell help for autism caused by genetic disorders? Yes, it definitely helps. We've treated a lot of autism who have genetic disorders. And like I said, what we are doing is we are repairing the brain damage. And because we're repairing the brain damage, it doesn't matter whether it's a genetic disorder or not, there are clinical improvements. My son has level 2 moderate autism and no behavioral issues. Will the stem cell therapy help with the social and communication issues? Yes, Lydia, it will definitely help. Moderate autism, the results are, among the best, and it will help him with his social and communication issues for sure. Now, please understand what we are doing here. We identified the damage in the brain that's causing the symptoms, and we fix the damage. That's what we do, all right? And then, of course, with various rehab, we will see improvements. Now, Dipti wants to know if stem cells is effective in case of developmental delay and kids with low IQ. Yes, it definitely helps. I didn't show all the details, but we have treated several hundreds of patients who have global developmental delay with low IQ, and they improve very well. I mean, they improve dramatically well in their academics, their understanding, their memory, their exam performance. So it definitely helps. And once we do the PET scan, we identify which part of the brain is working less, and then we are able to correct it. So, Dipti, yes, we can definitely help developmental delay. Shri asks, is there any risk of tumors due to stem cell therapy in the future? So the stem cells that we use, autologous cells from the bone, there is absolutely no risk of tumors, absolutely no risk. We are using adult stem cells from the bone marrow. And these bone marrow stem cells have been used for the last 50 years to treat blood cancers. Now, something which treats a cancer cannot cause a cancer. So autologous stem cells from the bone marrow cannot ever form tumors. There is no history, no record anywhere in the world over the last 50 years of patients with bone marrow forming tumors. Our own personal experience, and we've treated 10,000 patients, and we have a 12-year follow-up. We've never seen any tumor formation in any of our children. Anusha Chaladi asks, my son is having speech issues, not autistic. Can he be benefited from SCT? You know what? It's like difficult for me to. I need to understand what the problem is. So if it's a primarily speech issue, which is ENT related, then stem cell therapy won't help. But if it is brain related, neuro related, then it will help. So what you could do, Anusha, is set up a one-on-one discussion with me, and I'd like to understand your son's problems. We'd like to see some of his reports, see some videos of his, and when we do the one-on-one consult, and then we can, I'll be able to guide you better. Right now, I cannot guide. I cannot just, without knowing the child's problem in detail, I can't help you. Khejvi asks, my daughter is 4 years and has cerebral palsy, spastic quadriplegia, has speech problems. I want to know if stem cells will be of help. Yes, definitely, KG. Cerebral palsy with spastic quadriplegia and speech problems, fantastic improvements. The spasticity will go down, the upper limb movement, the lower limb movement will improve, the speech will improve. So you will see some very, very good improvements. I think it is definitely worth trying. Anusha Chaladi says, my son is having speech issue. Well, I just answered that question. Carlos, okay, please sign us to a 1:1 consultation. All right, we will do that. Carlos, we've made a note, and we will set up a consult with you. Anusha, all right, you have asked the same question again. He's having speech issues, not autistic. Thank you for answering a question. Much appreciated. Anusha, thank you. Sure, so we will connect. All right, with that, I would end the presentation. Thank you all for attending. I know it's very long. We started at 9:30. It's almost 12 o'clock India time. It's midnight here. So thank you very much for attending. I hope I was able to give you some insight into the problem. I hope I was able to shift you from a state of hopelessness to one of hope. And that is important. You know, as long as there is hope, we can keep going on, but we must know that there's something possible. So we are here, and we'd be very happy to help you. You will all be reached on your registered email IDs and maybe your telephones if we have them. And we will continue this discussion further. Thank you very much, and wish you all a lovely day ahead.